Hey there, and welcome. Today, we're going to talk about something really important, Polycystic Ovary Syndrome, or PCOS. We're going to cut through the confusion and get right into the early signals your body might be sending you, what they are, and what they really mean.
You know how it is. An irregular period you just blame on stress, or a random breakout you figure is from some new face wash. It all feels so random, right? But what if it's not? What if these are all little clues, part of a bigger story your body is trying to tell you?
So let's try to reframe this. Instead of seeing these things as annoying, separate problems, think of them as messages. Our goal here is to learn the language so you can understand exactly what's going on.
And hey, if you're hearing these whispers, I want you to know you are so far from alone. For millions of women, these are the very first signs of PCOS. Just understanding what they mean is the first and honestly the most powerful step you can take.
I mean, just how common is it? Well, it's estimated that PCOS affects up to 15% of women of reproductive age. To put that in perspective, that is more than 1 in every 10 people. So let's get into what's actually happening here.
At its very heart, PCOS is a hormonal issue. The best way to think about it is like your hormones are a huge, complex orchestra. When everything's working right, it's a beautiful symphony. But with PCOS, it's kind of like a couple sections of that orchestra are playing totally off-key.
So here's the official definition. PCOS is a hormonal imbalance where the ovaries start producing unusually high levels of hormones called androgens. And this one thing throws the whole system out of whack, leading to all the signals we're about to talk about.
So in our hormonal symphony, there are two main players that are out of tune. First, you've got androgens, which includes hormones like testosterone. Now, all women have them, but with PCOS, it's like that section of the orchestra is playing way, way too loudly. And second, there's insulin. That's the conductor for your blood sugar. In this case, the orchestra isn't really listening to its cues. This combo right here creates the foundation for PCOS.
All right, let's dive right in. We're going to break down the 5 most common early signals your body might be sending out. And just remember, every single one of these is a clue. It's a piece of the puzzle that helps you see the bigger picture. Okay, signal number 1 is probably the one you've heard about the most, a totally unpredictable menstrual cycle. And look, this is so much more than just an inconvenience, right? For so many, that uncertainty is a constant source of stress, and it can really impact things like family planning. This unpredictability can show up in a bunch of different ways. You might have something called oligomenorrhea. I know, it's a mouthful, but it just means you're having fewer than 8 periods a year. Or there's amenorrhea, which is when your period just stops completely for 3 months or more. For others, the timing is just all over the map, or maybe the flow is suddenly way lighter or much, much heavier than what's normal for you. So why? Why does the whole cycle just go haywire like this? Well, it all comes back to our off-key symphony. Those extra androgens, the ones playing too loudly, they completely disrupt the delicate dance of hormones that's needed for ovulation, the monthly release of an egg. Without that key event happening on a regular schedule, the timing for the entire cycle becomes totally unpredictable. Okay, now for our second and third signals. This is what I like to call the hair paradox because it's two opposite things happening at the same time, caused by the exact same culprit, those high androgen levels. So on one hand, you have signal number 2, unwanted hair growth, which is called hirsutism. This can look like coarse, dark hair showing up on the face, chest, or back. But then at the very same time, you can have signal number 3, which is thinning hair on your head, because those same hormones are making the hair follicles on your scalp shrink. It's a real paradox. Signal number 4 can be one of the most frustrating things to deal with. A constant struggle with weight, especially weight that seems to collect right around the abdomen. And it is so important to understand that this is not about a lack of willpower. It's a metabolic reality of this condition. So what is it that makes managing weight so incredibly difficult with PCOS? Well, the answer brings us back to that second instrument that's out of tune in our orchestra, insulin. This analogy here on the screen is a fantastic way to understand what's going on. Let's walk through it. Imagine all of your cells have little locks on them, and insulin is the key that unlocks them to let sugar in for energy. Simple enough. But with insulin resistance, those locks get jammed. They don't respond to the key anymore. So what does your body do? It panics and floods your system with more keys, tons of extra insulin trying to force those doors open. And this massive flood of insulin does 2 things. It tells your body to store more fat, and it screams at your ovaries to produce even more androgens. It's a vicious cycle.
All right, our fifth and final key signal is a very direct, very visible message from your body. It's called acanthosis nigricans. This shows up as patches of skin that get darker, thicker, and feel almost velvety. You'll usually find it in body folds, like on the back of the neck, in the armpits, or in the groin area.
So what exactly is this a sign of? Well, it's tied directly to that jammed lock problem we were just talking about. These skin changes are one of the clearest physical signs of significant insulin resistance. That huge flood of extra insulin in your system can actually cause your skin cells to start multiplying way too quickly. It's literally your body giving you a visual cue that your insulin levels are way too high. So, you've got all these signals, all these clues. How do doctors take all of this and turn it into actual clarity, a real diagnosis? Let's look at how it all comes together. To give an official diagnosis, doctors use what are called the Rotterdam criteria. And here is the most important part. You only need to meet 2 out of these 3 conditions. So you need to have irregular ovulation or signs of high androgens or polycystic ovaries seen on an ultrasound. This is huge because it means you can absolutely have PCOS without having a single cyst on your ovaries, even though polycystic is in the name. And this is the point I really want to drive home. Getting a diagnosis is not the end of the story. It is not some final scary verdict. It's actually a turning point. It's the beginning of your informed health journey. Look, it can feel completely overwhelming to get this diagnosis. I get it. But it is also the very first step toward getting clarity and, most importantly, control. PCOS is a manageable condition. And with this knowledge, you now have the power to work with doctors and start building a healthier, more balanced life. When you boil it all down, these signs and signals, they're just your body trying to start a conversation with you. Now that you understand the language it's speaking a little better, the real question is, are you ready to listen?